Good evening, everyone. I'm Dr. Anusha Matthew, Coordinator, National Institute of Clinical Excellence, Bengaluru. I welcome you all to the third session of Hidden Treasures of Plant Kingdom. It's an honor for me to introduce today's speaker, Professor Dr. Shreepad Hegde. Our faculty for today has over 38 years of clinical experience of treating diseases from allergies to cancer and over 35 years of teaching experience. He's on the consultative committee, MARP, for National Commission for Homeopathy and on Special Committee for Drug Proving of CCRH, Ministry of Ayush, New Delhi, a member of Governing Council, National Institute of Homeopathy, Kolkata. He is a director at Tattva Homeopathic Research Center, Bengaluru, president of Karnataka Qualified Homeopathic Doctors Association. He is a guest faculty, NHRIMH, Kottayam, under CCRH Ministry of Ayush. He is a recipient of prestigious eminent Best Teacher Award from Rajiv Gandhi University of Health Sciences, Bengaluru. Also prestigious Aryabhatta International Award for services in the field of medicine. Homeo Acharya Award by the Karnataka Qualified Homeopathic Doctors Association. Prestigious Homeo Gaurav Puraskar by IIHP. And he's recently been awarded Award of Excellence 2023 at 5th World Congress on Homeopathy by Sukul Institute of Homeopathic Research, Kolkata. He has till date presented more than 50 scientific papers nationally and internationally. He is a performer of Yakshagana and he represents India nationally. Presenting to you our beloved faculty and a very humble person, Professor Dr. Shreepad Hegde, sir. Sir, over to you, sir. You can start the session.
A very pleasant good afternoon or good evening. Because we are on online platform, I cannot see your expression as well as your feelings. Still, I feel that you are all in a good and joyful mood. And before starting something seriously discussion on the issues, I wish you all the best. See, under the Institute of NICE, what we are trying to bring, the practically what difficulties we face, how best we could able to handle that in a different ways to give a best relief to the patients. That was our objective. And with that constant, where Dr. H.L. Swami and few of his students, they started this institute 10 years ago. I congratulate them because this is the 10th year, decennial celebration they are doing. On behalf of that, we are all here today. See, I know many are busy practitioners who are in practice, and many are students, many are teachers, many are well-wishers. All we have gathered here to understand each other of certain practical difficulties what day-to-day we face. A man who is at the age of 18, a first-year student, or a man at the age of 80, still all we face practical difficulties in our practice. But by the same time, the way of understanding the materia medica or organon and philosophy or identifying a remedy through the repertory and giving the best simillimum to the patient. And before doing all these exercises, understanding of the patient is also equally important. With all these constant, we talk only, majority of the time, we talk only the practical aspect. Maybe understanding mathematically, maybe understanding disease-wise, maybe understanding pathologically, the physiopathological changes, what is taking place, where the patient is giving their complaints. All these things we are discussing under the banner of NICE Institute, educating and enriching the knowledge, sharing the knowledge. Through that learning and sharing, these exercises continues. That is the speciality of NICE. And we don't boost ourselves making a publicity, but we try to make humble way to see that how best we could able to approach to the patient and reach them practically. And last 2 classes, as a part of decennial celebration, Dr. Swami as well as Dr. V. Patel sir, they explained something. And let me put forth some of my experiences sharing today. And I hope literally, practically, positively, all you are attending here will respond for that, and we will try to learn. Okay. And in that also, our beloved faculties, they have decided that we will discuss about the plant kingdom. And under that plant, there are so many things that the world is so big, and plant kingdom is very difficult to understand and explain, because the same plant which grows in a different land, at a different fertile, at different weather, at different temperature, it varies and its medicinal effect varies. Even though they simply we say that it is a plant, Tulsi, Osimum, but where we see the Osimum at the Kerala is a different what we see in the Kashmir. But you see the same Osimum, though it looks the color in Gujarat is different, and when you see in the West Bengal or Bangladesh is different. This is when India only we see so much difference. Naturally, it has its different effects as a medicinal value also. That applies same thing for many. And for your information, in our Materia Medica, whatever the plants or the medicines prepared from the plant kingdom has been explained. These are all the things I have experimented in the European countries. For your information, I will tell you. Many times we are just carried away. That's why we get a confusion. Where we could able to make out ourselves that what are all the best things we could see, and let us learn something. And directly I am sharing some cases with you. Is visible, no?
Yes.
Only I am visible or whole slide is visible?
Yes, sir, it is visible. Slide is visible and you also visible.
Okay, both is visible. That is a good answer. See, there should not be a seriousness in the chair of a doctor, because if doctor is cheerful, naturally you could able to help the patient. Patient feels that okay, this doctor could able to help me something. Identify this plant. From starting only, my students, if anybody is attending, don't mistake me. Hegde sir always ask a questions. That was a I have taken as a complaint as well as compliment both from my students.
Dr. Premalata says Pulsatilla.
So let us see what she says. See, directly I am coming to the case. It's a case of migraine in girl. See, you know the typical migraine attacks. I need not explain how the symptoms, the forms. The headache, a periodic sick headache, the school-going girls, and the parents noticed, as well as even the child noticed, that it is a one-sided intolerable headache. It started after attaining the puberty. That is the minimum complaint what the patient could able to say. So what are all the medicines we can think of?
You can write in the chat box your answers. So they say Natramure by
Natramure, Calcareous, Pulsatilla,
China,
China, Calcaria, Natramure, Naxomica, Natramure,
Belladonna,
Phosphorus, Natramure,
Glonine,
Phosphorus, Pulsatilla, Natramure,
Cyclamen, Ferrumphos,
China,
Simicifuga, Pulsatilla, Spigelia, Glonine.
Okay. At least they can restrict themselves that the plant kingdom, no? Because we are discussing that. See, very interestingly, the main important causative factor what they are giving this after attaining the puberty. And in my practice, I have seen where some patients they come that they develop a headache, but this headache actually relieved once the menstrual flow starts. But majority of the times, this age group at the age of puberty, either the periods get delayed or periods won't happen, then this headache starts. This is a typical approach what they come with that. Once the menstruation you are correcting, then automatically headache also will be get corrected. This is a very specific complaint of the patient. And what are the remedies which has this affinity? See what somebody has mentioned like a calcarea phos, natrimur, pulsatilla. These are all the remedies which goes very nearer to that. But a very strong indication of the thing is that after attaining the puberty, though the school-going girls headache we mention in all these remedies, but still this is a very typical thing. In some of the cases, we see that it corrects the menstrual cycle. Along with that, it corrects or rectifies the headache also. That is a typical remedy. That is pulsatilla. And in the pulsatilla, majority of the times where there are complaints comes that even irregular menses or at the menarche they attain, but immediately stops. There is a irregularity. See whether what is the cause, many times we may not be able to identify. Even whatever the investigations we do, we may not be able to identify. That is the very specific affection or affinity of the pulsatilla. See, but many times you start the pulsatilla, first period starts, once the flow starts, then the regularity starts, headache automatically goes off. Then here what you have to concentrate, whether you have to concentrate on headache or you have to concentrate on period. This is since puberty. This headache started. Up till that, she was very healthy, happy. There was no problem at all. Yeah, this is the second case. I will show this, then I will explain. Okay, a software engineer just completed, very hardworking, and even after his job, he takes a tuition for the junior engineers, highly intellectual, but he cannot digest the food. That was his complaint. A very interesting thing. And he has developed this problem. Just I will run a. It is audible and visible?
Yes, sir.
Shall I repeat? I hope you got it.
Repeat, sir. Can't hear. Can't hear.
Huh?
Can't hear.
Can't hear.
Video can be seen, but sound is not visible. The sound is not audible.
In the chat box, they say probably it is burping, belching, hoarse sound, air hunger.
Yeah, it is a full volume. I think you can make out this burping and he's struggling hard to bring out.
Yes, sir. Choking.
Yeah, choking sensation and is trying hard. And this is the manifestation. If there is an indigestion, he cannot tolerate so many things. He says himself when he came to me, he was telling that he cannot eat wheat, he cannot eat the strong rice, he cannot eat any masala, he cannot eat even masala dosa, idli, what all the items we eat day to day, he cannot eat that. That is his problem. If he eats, then these things will start. He is very lean, thin, you could be able to make out, very humble, very pleasant. What medicine can be given? And even after eating, this is the complaint what he came with that. Actually, his first visit, I gave him with all these complaints, carbo veg. I'm telling you very clearly. The second visit, I could able to see his video also. Because when he was in the clinic, I could not able to make that day. He only brought and show me. He says very clearly, sir, my friend's birthday was there. I have not taken anything. Only ghee rice I ate. After that, this has started. This is very typical complaint. After
Ghee rice.
see, he brought this video and showed me. Sir, I have struggled so much. See, nothing comes out. It's only the air. What can be done? Whether we take up this case or we'll send for the gastroenterologist.
We have to take up the case.
He has consulted the gastroenterologist. They did the endoscopy and all the other tests. Nothing was there. Everything was normal. He's so young, but very weak. That I am underweight, sir. He is a lean, thin, emaciated, highly intellectual, and appealing in his personality.
In the chat box, they have written asafoetida, phosphorus, pulsatilla,
okay,
lycopodium, carbo-veg.
Okay. Already I gave carbohydrates. It didn't help him much.
Naxvomica.
And he says that he cannot eat.
Cyclamen.
Pulsatilla.
Pulsatilla. Why?
Food. Ailments from oily food.
See here what you can make out. See, this is intolerance of fat and deep fried food, sweets with more ghee or any oil. Here after ghee rice, he says very clearly. We don't know in the hotel what ghee they use. I have not asked whether it is a Nandini ghee or any other states ghee what they used. But he is very specific, and that all the things will happen. And these are all the things we see under what somebody has mentioned. No, in the chat box, what are all the medicines? The fat food aggravation, cyclamen after rich fatty food. I don't know anybody else. They have mentioned any other remedies name.
So they have written lycopodium, phosphorus,
phosphorus. Okay, means after ghee rice, only these three remedies stand.
Naxvomica, chelidonium.
Chelidonium. Yeah. See what somebody said rightly, the carbo veg and pulsatilla stands. Two remedies, even if you check it also. Three great remedies. And carbo is already the tried, it didn't help much. And he was very clearly saying that after the ghee rice, sir, suddenly it has increased, and this is a video what he has made it. And that made me to think of pulsatilla. Otherwise, I never thought that pulsatilla may help him. And here what I'm going to tell, the pulsatilla has got all these typicals, you know, the intolerance of fat in any form, or after deep fried food, either they develop a indigestion or they develop such things. Sweets with more ghee or any oil which is prepared in the deep fried food, that is the thing. And we see even in the pulsatilla, where I have seen many cases where urticaria, the rashes they develops after fried food or a spicy curried food. I have treated many cases where they come with such after taking such food. The two remedies, again another vegetable kingdom remedies, which is another remedy. One is a pulsatilla, another remedy. Anybody? After such spicy food or the oily food or a fried food, which gives a urticaria-like manifestations. Any other remedy you know? Because all your practitioners hope so. And that is also from plant kingdom.
Urtica urens, Naxvomica. From the chat box.
No.
Robinia.
No.
Rustox.
No, that is all the remedies for urticaria. My question is very simple. See, I am not asking a remedies for urticarial rashes or urticaria. My question is very simple. After such either spicy or the deep fried food, what they get it?
Phantom crude.
Include
Asafoetida.
Asafoetida. Again from vegetable kingdom, I said. And
Carbo
because
veg.
I have restricted myself to
Carbo veg.
carbo veg, no?
Oily food. Fried food. Fatty.
Par animalis.
If you read the downward sentence, lipid profile is high, increased cholesterol or triglycerides, fatty liver. That is the remedy.
Puja magnesium.
Chelidonium.
Yeah, very good. Who said that? Chelidonium. Give her a big hand. See, chelidonium has got a very good affinity for such things, and even chelidonium could able to reduce these two remedies. I don't know, in my practice, what I have seen, Pulsatilla as well as chelidonium, these two remedies could able to bring. Of late, we see in the city, fatty liver is more because of our nature of food and less exercise and only high thinking and selected eating habits. That's why I said lipid profile, where they come with the increased cholesterol or increased high triglycerides. They advise that lifelong they have to take the medicine. They should not stop. I don't know what happens if they stop, but that fear is there in their mind. These two remedies, pulse as well as chelidonium, it gives a very good relief to reduce the fatty liver as well as all these problems. Then for this man, after giving Pulsatilla, actually, this gentleman became all right. And his next visit, he came and said, Arre, sir, I don't know, you did some miracles. Now, today, I ate even ice cream also in one of the, they say, the weekend parties of the office. I never used to attend. You told me, no, you can go and start eating slowly, little quantity. Today, I have taken all the items, whatever they have kept, hardly 2 spoon. But today, I didn't have much problem, but the problem is that. But there is some good relief, but he got it. That is the typical hidden action of Pulsatilla. We never think that, where it could be able to correct. Though you may feel it is a very superficial problem, but he cannot digest, he cannot eat, he cannot enjoy the company. And he says, he was telling actually, even in the home, after taking my morning breakfast, I go to upstairs where family members, they should not see me. Many times I have vomited and I suffered like this, but I cannot tell them. See, because they also feel bad. That is another typical characteristic feature of Pulsatilla, I will tell you. Even psychologically, see, they are very much concerned. See, this is another case, a very interesting thing. You may see the photo is a girl's photo, and here this, right? See, this gentleman, 72 years old, a retired ISRO scientist. He had a BPH, means benign prostatic hypertrophy, and he underwent a prostatectomy, means they do the transurethral, this is actually just a scraping, not fully resection of the prostate. And after that, he developed the stricture urethra. Then he came to me, a senior man. This case, still I remember, maybe some 10 years back, but I have treated him. And so highly educated, highly religious person, and very humble, very pleasant personality. And he explained, sir, I was helpless because one fine morning where I could not able to pass my urine and I have to rush to the hospital. They did a catheterization and they did all these procedures. He is not a diabetic, he is not hypertensive. But the stricture urethra started. Again, the prostatic enlargement is there. He is in trouble. What medicine can be given?
Staphysagria.
Staphysagria. Good. Next. No, you are right. Staphysagria is one of the remedy for a soft tissue injury as well as correction of the strictures. No doubt at all. Any other remedy? Anybody is writing?
Ambra gricia and Subalcerulatus. Ponium.
Subalcerulata.
Ponium.
Ponium. Yes. Conium. Then
Solidago.
remedies.
Solidago.
At least some 50% are there. Some at least 8-10 remedies also should come. No? Which is Solidago. Then
Cantharis.
Cantharis. Then
Digitalis.
Digitalis. Very good. Digitalis.
Clematis.
What happened? Which remedy?
Clematis.
Very good. Clematis. Who has written that?
Dr. Shreepriya.
Shreepriya. Okay, good.
Apis. Apis.
Apis. Okay, these are all the good remedies. Yeah, but she said clematis. See, I also thought of very simple way. I will tell you because we don't have any other options. A limited expression was there from the patient. Yeah, clematis and conium has been tried, but there was not much improvement. Along with that, subacellata also has been given. See, we could not able to find much improvement with that. And he comes, he said, because already he had that experience of catheterization, recanalization, or sorry, this resection and all this. He said, in throughout my life, I never had any problem. First time I admitted, all these emotional attachments were there. What happened every time he used to explain some slokas, this, that, at that age, many they have that fashion. And he was explaining. Then I was asking, what is your daughter is doing? Then he said, my daughter is doing her PhD. And yesterday, she scored a highest marks. They awarded the PhD in the university. When he started narrating of this her daughter's story, his eyes actually become wet and he started crying on literally. I said, he started weeping. It's a good moment, no, a happy moment. See, even in the happy moment, he was just like a crying, weeping. I said, your daughter has got, no, I'm so proud. My daughter has got this, right? I said, this is something a different thing. I thought, okay, sometime, some emotionally, some persons, they do like that. This is maybe a crying habit. Like. Then after some 10, 15 minutes, this, that, we are just discussing so many things. Then I said, no, I have been promoted in the college as a professor or something, I said. Then also the eyes became wet and he started crying. I said, this is my problem. This is nothing to do with him. Then he said, no, you are my doctor and you have got some good movement. That's why I'm very proud of you. That's why, this is a very important point. I caught that, okay, this man is something different than this because he cries. This is what we call typically the medical language is a crying man. For happiness also he cries. He says that, no, my missus had a fibroid uterus. We have to do a hysterectomy. Then there was some problem. Nobody was there to take care. My daughter was away. And my son is also away for study in foreign countries. This, that, there during that time also, the eyes became wet and he started crying. This is a very interesting. I thought, okay, during happiness also he cries. During sorrow, some explaining some difficulties in his, then also he cries. This is what a weeping disposition weeps both in sorrowness, in happiness, and any situation such things are there. That is a sensitivity level of which remedy?
Pulsatilla, sir.
Pulsatilla.
Pulsatilla. See, for my surprise, once I started Pulsatilla, he started improving like a magic. And next visit he came that, I don't know, doctor, what you did it. See, he put his hands and said, and then see, my urine started to normal. I didn't have any struggle. Night, the frequency has come down. See, I never thought the Pulsatilla could be able to help for a patient for benign prostatic hypertrophy. See, we have seen in a Pulsatilla, for example, I will tell you. So what we see, there is a gleat, they explain. There is a gleat, they explain in the Medica. Gleat means actually a chronic urethritis, maybe because of gonorrhea. Then, now hardly we see the gonorrhea, maybe because of the invention of antibiotics. Hardly we see, I have seen in my early practice. But I think you youngsters, you might have not seen a classical gonorrhea cases where a greenish yellowish or a yellowish greenish discharge comes from the urethra. But I have seen such cases. Certain after certain incidents, it used to come. That is the typical thing what they explain in the pulsatilla. There is a urethritis, maybe because of the gonorrheal discharges. Typical, that is a discharge what we see in pulsatilla, either a greenish or a yellowish discharge, either a thick or a semi-solid thick. That is typically after prescribing. Here, prescription is based on what? Crying, weeping. See, he was just crying for happiness, for sorrow, for all purpose. That is his nature. That is a higher value of pulsatilla. After pulsatilla, he started improving. A very interesting personality. Okay, I don't know how many you have been treated benign prostatic hypertrophy as well as stricture urethra with a pulsatilla. These are all the typical symptoms. By their expression, we have to identify and prescribe that. This is a one more case, and what you said, epileptic case. What is these flowers? Pulsatilla. Now I think after 2 cases or 3 cases of pulsatilla, you thought I'm talking only pulsatilla. Not necessary, because they said treasures of plant kingdom. Anything you can discuss, sir. Don't stick on. Maybe this is so colorful. The epileptic case, you are a child at the age of puberty again, where the hormone changes takes place. During that time, where the convulsions came. Twice the convulsions in the school. A 6th standard girl, she has developed the epilepsy, and she has been given all the examinations, whatever the things are available, including the EEG, CT scanning of the brain, and all the blood test and all, except hemoglobin was 10.5, remaining all the things were normal. But the child had 2 attacks. Even where a neurophysician said, no, we'll wait, we need not start any medicine. And even patients were also aware, if they start the medicine, the child has to sleep. It may be a sleeping or may not be good for the health and all. They have their own understanding. They came. But here the very interesting thing is that a convulsions or epilepsy at the age of menarche or the puberty, what are the remedies? There is no other cause, I will tell you. Just tell me if you could able to say what are all the medicines we could able to.
Causticum, cyclamen, calcarea, cuprum, pulsatilla.
Somebody has written.
Cuprum met, sir.
Huh?
Causticum, calcarea, pulsatilla.
Wow, very good. Today our participants are very intelligent, no?
Zincum.
And they are very honest and sincerely they are, okay, zincum. Yeah. The affinities towards that. And very clearly there are, what are the remedies? Anusha, please repeat.
Colophyllum, valerium, Actia racemosa, agaricus.
This is, see, dear doctors, just don't mention what are all the remedies for epilepsy or convulsions. My question is very clear. Where the convulsions at the age of puberty. Sometimes where menses won't take place, then also they develop. Or even menses takes place also without any reason also, they may develop. They have a typical that constitution. And this girl also, they happen the same thing. There are only the 2 remedies which I say mainly useful, especially in the girls. At the age of menarche or the puberty, is a 2. One is causticum, another one is pulsatilla, for your information. Causticum and pulsatilla. And in this case also, where the pulsatilla helped. See, initially, even in the nice classes, we discuss about the selection of potentials. See, that is a big debatable issue. When even I was a first year student, I was hearing, and now also I am hearing the same dialogues on the platform from many senior faculties. As well as juniors, they have used to ask questions, sir, what potency you give and how it helped. See, here we have seen some 3-4 cases, and in that Shastri's case, it was a moderate dose. They were Pulsatilla 200 has been given. And is what epileptic case, what I was talking here, directly I started with the Pulsatilla 10 mg. The indications were very clear. Where I am not explaining each and everything of Pulsatilla's mindset, how the girl came, how she entered into the clinic, how she started narrating her story, or she was not ready to tell anything because she thinks that it is something wrong. Where if her friends and others they come to know, and it may be a problem in the school, they may identify me or they may keep me away from their friendship. There are so many things comes. This is all a sensitivity level of Pulsatilla. That all the things we can demonstrate on the patient. See, this is what we actually discuss or we inform who attends our nice classes. There I have started actually Pulsatilla 10 mg. See, even these are all the things. Why I am telling, even another case, what was the first case? The lower potency, that fatty liver, that boy, engineer with a gastric, otherwise we can say the ghee rice person. Yeah. That ghee rice man, I have started with Pulsatilla 30, where the repeated doses of Pulsatilla 30 could able to bring down his problem, and he could able to get a relief. Later, we could able to increase. You know, there is a certain protocols for increasing of the potency or a decision of the potency also. Why we decide the highest or the lowest potencies, all these things comes under that. We discuss that. I am informing it for you could able to make so many cases, their understanding, and depending on so many factors, maybe their constitution, maybe the temperament, maybe the depth of the pathology, and maybe the organ involved in their suffering. There's so many criteria comes for the selection of the remedy. Okay. Trapti, you wanted a gap?
Yes.
An interval for.
As you all know, we are celebrating our decennial year. We would like you to hear the experiences from our nice alumni.
मैं डॉक्टर श्रीपाद हूँ, प्रयागराज में रहती हूँ। मैंने नाइट्स इंस्टीट्यूट से मेटामॉर्फोसिस कोर्स किया था, डिप्लोमा इन एडवांस क्लासिकल होम्योपैथी। तो डॉक्टर पटेल सर, डॉक्टर श्रीपाद हेगड़े सर एंड डॉक्टर स्वामी सर के मार्गदर्शन में ये जो कोर्स किया है, इससे हम लोगों को क्लासिकल होम्योपैथी में जो हम कॉलेजेस में पढ़ते हैं, जो कोर्स पढ़ते हैं, और फिर प्रैक्टिकल में पेशेंट्स के ऊपर अप्लाई करने में जो हम लोगों को बाधाएं आती हैं, जो प्रॉब्लम्स आती हैं, फ्रॉम थ्योरी टू प्रैक्टिकल कैसे अप्लाई करना है, कब अप्लाई करना है, किन पेशेंट्स पे करना है, नहीं भी करना है कुछ चीज़ों को, क्रॉनिक केसेस, एक्यूट केसेस, सेकेंड प्रिस्क्रिप्शन, माइजम का एप्लीकेशन, माइजम की बेटर अंडरस्टैंडिंग, ये सब चीजें कोर्स को करने से बहुत क्लियर हुई। पहले मैंने ये कोर्स किया, इसके बाद मुझे बहुत मदद मिली इससे, तो फिर मैंने DTDM कोर्स ज्वाइन किया दोबारा, डिप्लोमा इन थायराइड एंड डायबिटीज मेलाइटिस के मैनेजमेंट के लिए। तो अभी वो कोर्स चल रहा है, अब लगभग खत्म होने वाला है, पर मैंने सोचा है कि आगे जो भी कोर्सेस नए लॉन्च होंगे, मैं जरूर सर लोगों का आशीर्वाद लेने के लिए, उनका गाइडेंस लेने के लिए, उनकी टीचिंग्स लेने के लिए जरूर ज्वाइन करूंगी। और मैं सभी को ये सजेस्ट करती हूँ कि इस तरह का कोर्स जरूर करें नाइस इंस्टीट्यूट से।
I'm Dr. Khyati. I'm practicing homeopathy since past 10 years. Currently, I'm practicing in Bangalore. I'm associated with NICE Institute since past 6 months. I'm pursuing their DTDM course. And I must say, as the name suggests, it's not only helping me out clinically in my diabetes and thyroid cases, but it is really helping out in my overall practice because of the small mistakes we make clinically gradually in our practice. And to specify about the diabetes and thyroid cases, I would say the complications, tapering down of the doses, and relapse of the cases, and most importantly, I would say the main USP what I felt was what exactly to treat in the patient, because the amazing mentors in the institute, they put in front of us their live cases, their practical experiences, which we don't get it anywhere. So I'm thankful to NICE that I got this opportunity, and definitely if you are aware about it, go ahead with the course. It will really make wonders in your practice.
I've been attending a course with the DTTM NICE Institute, and it was very nice institute to say that Dr. Patel sir, Dr. Swami sir, and Dr. Shreepad Hegde sir, and practical demonstration of cases were dealt with. And this 6 months course was very useful, and my clinical practice has improved, and I could be able to understand what is to be done with a thyroid case and diabetic case, and how to prevent them getting into diabetes. It is very, very important to deal with root cause in such cases, and how to use intercurrent remedy and how to use small remedy. It is very useful to practice with this sessions.
Thank you everyone for your patience. Thank you. And for more details, you can log into www.nicehomeopathy.com. Thank you, sir. Over to you, sir. Continue the session.
Thank you. I hope we got somewhere here, no?
Pulsatilla in epileptic case.
It is over, no? Epilepsy is cured.
Yes, sir. We have to go to next case.
See, all the cases cannot be discussed, doctor. And especially, see, they have a tendency like that. See, how in the Hindi they say, no, the Rote Surat. Or in Kannada they say Almunji. See, they cry more instead of they explain more. See, that is a very specialty. Here is a, I don't know how many you have seen the wife and husband. Here, the case, husband explains that, say, I was so busy in the office. I am a HR, means the human resource senior manager. I have so many works, but still my wife said that I have come back and we will go to the movie today by 6:30 show, and all the things would be done. And she is also a software engineer. They made a plan. But what happened, because this fellow was attending a meeting, husband, and it was delayed for half an hour, 45 minutes. By the time when he reached back home to pick her up, and she has changed her clothes, she was crying. And she said, no, we are not going. And that has become a big fight. And somehow she was solacing, and ultimately that plan has changed, and she took him to a jewelry shop. They purchased the gold bangles. They came back home. This is a very typical mindset. What is that? Now, who is a wife? Who is a husband? This is a very simple case. I just explained in brief because we have less time. Now, there is a, you got my point? See, both are busy. Both have their own this thing. And he also shouted, and all he did. See, I am also working in an office. You should understand my situation, and you should understand my position. I cannot just make it. for you, this, that, and this cried. And all these complaints, when they came to clinic, they were explaining. And the husband is explaining so nicely her complaints that she was sitting calmly and listening. Sir, however we fight, my missus gets her job done. At the end, she only wins, and she knows how to win the battle.
Manipulate.
Not manipulation, convincing, taking them into a confidence, a sensitive, a challenging, a sweetness, I can say. See, because he agreed. However, he is a rampant or what I can say, the arrogant or not obeying. Because the HRs have got what I have seen, majority of 90% of the HRs have got a high ego. They think
Nakswamika.
like that. Huh?
Nakswamika.
Nakswamika. Okay, you take it, Nakswamika. However you feel. Others, what they feel. Who is a husband? Who is wife and who is husband? That is my question. See, why I tell? See, otherwise also.
Wife is natramure.
Huh?
Dr.
Natramure is a
Purnima
husband.
says wife is natramure.
Wife is natramure. Good.
Pulsatilla, wife, Dr.
Pulsatilla,
Shreepad.
wife.
Role reversal, Dr. Rekha. Husband, Nakswamika.
Husband, Nakswamika. Okay.
Any other answers? Wife, Platina, Dr. Malateshappa.
Role reversal. Good. Rekha is commenting. Pulsatilla, husband, Naks. We are fixing.
Wife,
Platina.
husband, Pulsatilla.
This is not dominating. See, in the Platina, she dominates. She will not listen to him. Then the things will break. How the many understanding of the marriages breaks like that. They are the Platina. See, somebody made a Platina. No, their understanding is so. And Lycopodium goes nearer to that. Their husband is also like that. And is most here let us first fix either a wife or a husband. The wife you can fix this very easily because she's so highly talented. There are two things we should observe. She changed her mind. Instead of going to movie, she took him to market. That also purchasing a gold.
Okay.
See, which husband will agree for that? Immediately no one will agree. But she has taken him into a confidence, convinced him. That is the speciality of Pulsatilla. One is a change, mindset change suddenly. There is a changeability is the characteristic feature of Pulsatilla. You take it granted, I will tell you. Not only the thought process, even in the action also. That's what even husband was telling. However, I say, sir, she knows how to convince me and change the things. That the changeability, the migration from one idea to another idea, from one part to the another part, that is a speciality of Pulsatilla. Even the pain, shifting, thoughts, shifting, ideas, shifting. See, she knows how to convince. Get a confidence from every family. There, one of the author, he explains the Pulsatilla child so like that, if there is a birthday party, the cake they have cut, if the cake pieces are unequal, the Pulsatilla girl will select the smallest one to get the confidence of each and every person. See, naturally, the children will select which is the bigger one, no? That is the child's nature. But Pulsatilla child is different from this. These examples they give so nicely. Here also, this is husband, you can take it, Natramur, you say, Nakswamika, you say, any damn person, you say. Okay? Maybe another 5-10 minutes I have to be with you. This is another case of a female child after mumps. See, after mumps where the pain and swelling shift from parotid to breast, from breast to ovaries, then infertility arises. In brief, I have just written. I have seen many cases where in the past history try to extract the thing like that, whether the woman had a mumps, and especially the mumps after the age of puberty, if they get it, if it is a bilateral, the more chances are there they may become infertile. This is one of the best reason. Or if it is a unilateral, which side is affected, naturally the same side of the ovaries are affected, it is not functioning. I have treated many cases of infertility on this line of things. And even we have seen mumps have disappeared after a month or something where the patient has developed a lump in the breast. Especially we see the left side. And by the same time, after that has slowly subsided, even with treatment or without treatment, where ovaries get affected. That is a typical shifting from one organ to another organ where Pulsatilla stands first. That's what I was telling you, how it shifts, changeability, changing, shifting, migrating. That is the speciality of pulse. And here we see after the mumps. And mumps, even otherwise also in the childhood, mumps happens even whether it's a bilateral or unilateral, chances are very less where they may not get a ovaries or other things are affected because that has not been grown properly. But once the adolescent they reach, after the puberty, if they get a mumps, one should be very careful where their ovaries or the breast should not get affected because of that. Otherwise, they may come with this problem. Where unilateral, they are safe, another ovary may be so good. This is a one thing. This plant is also Pulsatilla. Pulsatilla medicine is used from what? The whole fresh plant is used, including the roots, for the preparation of Pulsatilla. The case of a male child after mumps. See, just we thought of only the female child. In the male child, even I have treated a patient came with a complaining of lower abdominal pain. Pain sometimes shifts from lower abdomen to the testes, sometimes testes to the abdomen. Where the parents were also confused. Sometimes he says pain is there and sometimes he says pain in lower abdomen. Initially, they thought it may be a renal colic, renal calculi. But when we examined the history of mumps were that 2 months back. After that, where the child has developed the pain in the testis. And when we examine, there is a swollen testis as well as it was tender. That was a typical shifting from the mumps to the abdomen, especially the testis. There are also the possibilities like that. If it is a bilateral mumps, where they get a very typical chances of oophorytis, though may not be very severe, but some cases we have seen where their semen quantity is ready. In one of the women, still I remember, because after the mumps, one side were the unilateral, after the age of puberty, at the age of 22, she developed the mumps, and one side there was a blockage of the uterine tube. That was a very typical symptoms we see. But this Pulsatilla could be able to take care of that if there is a constriction has not taken place. See, this is typically the Pulsatilla is called as. You are all aware of that, correct? What is Pulsatilla is known as? Weathercock or a wind vane. Hey, that's why here I say a person who is fickle mind or changeable. It connects well with fair complexion individuals with a mild and timid temperament who cry easily and are prone to sudden mood swings. This is what I said. There was a mood in that lady to go to movie. That mood has changed immediately. That is changeability. It is not only the ideas and other things, even mood also. Mood swings. Pulsatilla patients sometimes suddenly they cry, sometimes they become, suddenly they are happy. That is all the typical thing. I think you know this instrument. What is this? This weathercock is there. Have you seen any time it stands in one position? Have you seen? I don't know how many you have seen that.
No, sir. It will always constantly move.
That is a typical Pulsatilla. I followed it. Pulsatilla, whether it's a man, woman, child, either male, female, or a aged person. That is typical one of the feature, even mind as well as body. They are not restless, but they change. Mood changes. They say, then today I wanted to go to temple. We thought we'll go to, what is that? Some mall. Garda mall. Or we'll go to some other place. Windflower, changeableness and contradicting. You know another contradictory remedy. What are those? Ignatia, Natramur, Sepia, so many. See, but majority of the times we don't think about this Pulsatilla. Pulsatilla is also one of the contradictory lady. You don't think like that she will agree for everything. Though she may be a mild, she know how to convince and get. That's why wants the head high. In that figure you have seen how the peacock was there. It is at the top, no. That is typical Pulsatilla's nature. Feels uncomfortable with only one pillow, even physically also. Always the Pulsatilla patients, how they sleep, you can observe or you can ask and inquire. They use 2 pillows or sometimes 3 pillows. They see even the head should be high. They lies with hands above head like that. See, they lie down, sleep like this. Cannot sleep on the left side as it increases the palpitation and suffocation. That is some of the advanced cases. Confused, frightful, anxious dreams, late falling asleep, sleeplessness on account of flushes of heat. See, even this remedy helps where all the other features agrees during menopause also. That's why some of the authors of Mater Medica, they say that Pulsatilla is a remedy for puberty. By the same time, it is a remedy for menopause also. Why? Because the hormone changes takes place both the time in the woman, at the puberty as well as menopause. That's why where you have to think about the Pulsatilla in both the situations. The Pulsatilla patient is an interesting one found in any household where there are plenty of young girls are there. There you could able to identify who is Pulsatilla, who is Natramur, who is Chamomilla, who is Sina. You could able to identify. She is very tearful, plethoric, and generally has little credit for being sick from her appearance. Yet she is most nervous, fidgety, changeable, easily adjustable, and easily persuaded. And to say that Pulsatilla child in a family, she is very happy going with all the persons. She will adjust with everyone. See, though her contradictions are there, that is for limited. She will go to the grandparents, she will adjust there. She will go to the others, she will adjust there. That is a typical Pulsatilla. Pulsatilla actually binds the family. Their sepia breaks the family. Just remember, just while she is mild, gentle, and tearful, yet she is remarkably irritable. The sense of pugnacity, but easily irritated, extremely touchy, always feels slighted or fears she will be slighted, sensible to every social influence. Melancholia, sadness, weeping, despair, religious despair, fanatic, flow of notions and whims that she has her own. Is she Pulsatilla? Just image. Aversion to marriage is a strong symptom in Pulsatilla. But by the same time, where the authors, the great authors, they explain Pulsatilla is an nymphomania. Exaggerated sexual desire. Imaginative, extremely excitable. She imagines that company of the opposite sex a dangerous thing to cultivate, and that it is dangerous to do certain things well established in society as good for the human race. This fear is there in her mind. By the same time, she has a aversion to marriage, but exaggerated sexual desire. That is her internal feeling. This is nymphomaniac. See, wild, beside herself with sexual thoughts, uncontrollable sexual desire. This is a Pulsatilla's hidden nature, though the expression Pulsatilla hates marriage, but internally, this is the thing what the Pulsatilla. Another, is he Pulsatilla? See, this is a man. Aversion to marriage is a strong symptom. Here also, very interesting. A man makes it into his head that it is an evil thing to have a sexual intercourse with his wife and abstains from it. That is Pulsatilla. I have treated recently a patient, actually, they have a highly religious thing. the husband has got thing like that. After marriage, some 4 or 5 months, they should not have a sex. He has some vrata, something, this, that. See, then there was a lot of disturbances. And his wife, poor girl, she was actually about to give him a divorce, this, that. There was a lot of discomfort started. But when we gave Pulsatilla, slowly he became all right. As religious things have been, see, religious freaks, and a special tendency to dwell on religious notions, fixed ideas concerning the scripture. He misuses and misapplies that knowledge. That's why where he thinks that having a sexual intercourse with wife is not good. This is a typical complaint where I have seen recently a case. A sexual desire unusually very strong, but they have a bad thinking in that. Long-lasting morning erections, inflammation of the prostate. Just I was explaining a case of prostate in old sinners. This is sinners. They use a word like where there was an exposure and all. That's why I say the gleat and chronic gonorrhea and all that you can just ignore. With the enlarged prostate, hard, flat, packed feces. See, they have a constipation also. Pulsatilla is a remedy for constipation, I will tell you, especially in the elderly persons. Must always use a catheter, especially when trouble has been brought on by sexual abuse. This is what I was talking about, the stricture urethra or some other problem. Pain in the testicles, hearing, pain in the swollen testis, pain along the cord like cutting of knives, lacerating and tearing type of pain. This is what this is Pulsatilla he, that is Pulsatilla she. Just remember, Pulsatilla is not only for a woman, it in the men also. Or I say in other way, many men are Pulsatilla. You got it? And hormone changes cases where we see the many lot day-to-day practice also. Though it is a deep acting remedy, but pathology is not very deep in Pulsatilla. Try to remember. Otherwise, also in the vegetable kingdoms, what we see, majority of the things are superficial in its action. Milk in the breast at puberty, I have seen many cases where milk flows after pregnancy. That is a different thing. Hormone changes where the menstrual disorder starts. In spite of menstrual disorder, there is a leukorrhea we have seen. In spite of menses leukorrhea, that is Pulsatilla. Once the after your prescription of Pulsatilla, menses starts automatically these things. Where milk in the breast also we have seen, and so like that, there are so many changes we see as a hormonal effect on the patients. Even we see the acne, we see the thyroid disorders, we see sometimes where even diabetic changes at the puberty. What is the mechanism of Pulsatilla? This is a very interesting thing. You may have you have to think yourself. Otherwise, you take your own time. At the end, you can say. And pain of Pulsatilla, just I will go fast. Symptoms ever changing. No two chills, no two stools, no two attacks alike. Very well. 1 hour, very miserable the next. This is typically thing apparently contradictory. That's what I was told. Where Ignatia stands along with the Pulsatilla. Pains drawing, tearing, erratic. Remember, rapidly shifting from one part to another part. That's why you see where rheumatic arthritis, where Pulsatilla stands first, and along with the Calibi, Clacana, Magne, as well as Rustoxbrania, are accompanied with constant chilliness. The more severe the pain, the more severe the chill. Appear suddenly, leave gradually, or a tension much increases until very acute, and then let us up with a snap. This is the patient thinks. But on the first motion, like a Rustox, patient gets a disturbances. As per Clark, Pulsatilla is chilly patient. For your information, I will tell you. You are all in the impression that Pulsatilla is extreme aversion to heat. Chief of all complaints, aggravation by warmth and covering warm applications, closed room aggravation by lying on left side or a painless side, familiarization by cold open air, cold drinks and cold room, familiarization by lying on painful side. I remember one of the lady with a headache, she used to say, sir, fridge bag takumbo tongaligi tala itkotini sir, then I became all right. See, such cases we see even in the arsenic also, but Pulsatilla has got the typical thing in that. See, I am just concluding here. Thank you so much for patient hearing, and I hope I thank to the nice staff for organizing this presentation as well as, see, for me the quantity is not important, quality. Who have all attended, where shared your knowledge with me, made my knowledge enriched, and giving opportunity to present naturally. I feel I am very proud of all of you. I wish you all the best. Thank you.
Thank you, sir. Now I call
Thank you,
upon
sir, for
Dr.
wonderful
H.S.
presentation.
Swami, sir, to conclude the session and say a few words.
Thank you, sir. Hegde sir, thank you very much, sir, for wonderful and vivid presentation. I think all characteristic symptoms of the pulsatilla with each one, with each different cases. See, this is the beauty of a good teacher. So he presented on 5 cases. All the 5 cases belongs to pulsatilla in a different aspect. It is not the repetition. So in a different characteristic symptoms.
8 cases, Swami.
8 cases. 8 cases, 8
And
characteristics.
8 cases, I think I might have covered pulsatilla only 25% of the pulsatilla. As for your information, I will tell you. Because it's a very vast polycrest remedy. There's so many things are there. That is a treasury of Mater Medica.
So because of constraint of time, if I mean, you could finish this. So this one. Otherwise, I think for another 1 or 2 hours, he can easily explain the pulsatilla. So even though sir is a teacher for me, and for so many, I think from GHMC when he started to until his retirement, he was a teacher for so many batches. But still, he is down to earth. And one of the beautiful characters of Dr. Shreepad Hegde sir is he's always smiling. He smiles. That itself is a charishma. I think for a practitioner, we should have that one. No patient comes with happiness to us. Everybody comes with only misery and pain. At least by seeing that smiling face, they should feel relieved, relaxed. So that and evergreen like our Devanand. So Shreepad Hegde is Devanand of our homeopathic this thing. It's a evergreen hero. So thank you, sir. Thank you very much. In spite of his busy schedule, you accepted our invitation and presented wonderful cases. I thank Dr. B.D. Patel, sir. So in spite of his busy schedule, he came, and he's the one person I seen 50 years of experience, I mean, teaching and practice more than 50 years. Still, he is always be there whenever there is something to learn. That one character, generally, after a few years of practice, they think that I know everything. What is there to learn? See, for a medical practitioner, until his death, he is a student. That we should learn from him. Thank you, sir. Thank you for.
You said, I know everything. I know everything.
And because of the blessings of Patel sir and Hegde sir, today they completed 10 valuable years in the homeopathic this one. And we wanted, this is a Thanksgiving sessions. We wanted to thank the profession for allowing us this thing. And here, I want to take, I want to extend my thanks for the people, either in front or back, with support. Lot of people supported us from the last 10 years, directly, indirectly. I thank all of you, and I thank our core committee members. I thank all the doctors who participated, even in the late night, you all there, and enthusiastically, actively participated. Thank you all. God bless you all. Let us learn.